My name is Leslie Fletcher. I'm a nurse practitioner in Los Angeles, California. I've been in the field of aesthetics for 25 years. I worked with a board-certified plastic surgeon and a celebrity dermatologist, but for the past 15 years, I've actually owned my own practice in Southern California. Our practice has been named in the top 0.05% of use for the nation for neuromodulators such as Botox and dermal fillers. I'm an international speaker and trainer for Allergan, and as well as my own private training company, I've educated nearly 10,000 practitioners in the field of aesthetic, published more than 20 peer-reviewed articles advancing the field of aesthetics among practitioners. But today, I'm actually coming to you on behalf of Authority Magazine, where I want to give you my top 5 tips to creating radiant skin. Now, these top tips are going to be practical, reasonable, something you can do at home, and different from what you've heard before, because I wanted to make this unique and interesting for you. These are going to help you ward off early signs of aging. The first one is to sleep on your back. This is the cheapest anti-aging trick that I can teach you. When I assess patients in the clinic, I can tell within minutes what side they prefer to sleep on. Is it the left or the right? And if you just think about it, for 8 hours, you're creating creases and descent on the sleeping side, whatever side that is. They don't exist on the non-sleeping side. And they actually don't follow the natural pattern of creases from typical expressions, such as the forehead lines and frowns. When I'm treating their skin, it's actually more challenging to repair that damage. When night after night, I treat them and then they just put pressure on their face for hours on end. Research shows us that only 30% of people sleep on their back, and the average person changes position left, right, and center 20 times per night. I love to teach patients how to retrain themselves so they're not flipping around all night in this aspect of positive aging. Some practical tips on retraining to go back to sleep, if you will, is to shove yourself in between 2 pillows. I actually sleep with 6 pillows at night. My husband loves it. It supports your side so you don't turn around. I put pillows under my legs so that it supports my back. It actually kind of feels like I'm in a lazy boy. This may not be ideal if you need to elevate your head for like sleep apnea or if you have GERD, but think about retraining yourself. The second is red light therapy. Early adaptations for LED therapy were developed by astronauts to avoid the rapid loss of bone and muscle mass that can occur in space due to weightlessness. They also noted there was anti-inflammatory benefits, which affected the skin and actually promoted tissue growth as an effective pain management alternative. So there are a lot of benefits. So there's several devices for at-home use that are FDA cleared that have both the 633 nanometer and the 830 nanometer combined technology, which creates the most efficacious results. They come in the way of masks or domes, if you will, but it helps the light to penetrate deeper, stimulating the fibroblasts and increasing collagen on a cellular level. It's going to translate to you for firmer, younger, smoother skin and fewer wrinkles and dark spots. Next, stay away from the sun. UV exposure for sure causes acute inflammation, which causes the release of enzymes called matrix metalloproteinase that break down collagen. Collagen is crucial for the support of the skin envelope, and when it dissipates at a rapid rate, the effects reveal saggy, dehydrated, wrinkled, and collapsed skin. The next is also due to inflammation. Daily antihistamines. An increase in histamine is going to expand blood vessels and cause the smooth muscle tissues to contract in the skin, which is going to make the skin appear ruddy, crepey, and puffy. So a daily antihistamine like Claritin or Xyzal, that's going to actually help with that. Of course, every medication, over the counter or prescription, has its own side effects, so reach out to your primary care provider to confirm that you would be a good candidate for daily antihistamines. And when we think about ourselves as having allergies, a lot of people don't actually know that they have allergies because they're not sneezing, they don't have ruddy eyes, but it actually could manifest in different ways, such as inflammation in the skin, usually puffiness around the eyes, redness, those types of things. And I've had patients who have not believed me, and they've gone on antihistamines for a month, and I have their photographic evidence 1 month before they've tried and then a month afterwards, and you can really tell. It looks like they've had skin tightening treatments, lasers, and really all that they did was take the antihistamine. So you might want to try it. The next one is medical grade skincare, and that's going to include retinol. There are numerous studies on topical vitamin A based skincare containing retinoids. In fact, it's the most used and the most studied topical positive aging agent out there. It was developed in the 70s to help tame acne, but the effects of the skin showed to not only help with the acne, but also to lighten, brighten, and tighten the skin. So research shows it can actually efface wrinkles just within 4 weeks, and the effects are even better with continued use. This is something you could be on the rest of your life. The way it works is it increases the cell's rate of turnover and promotes fibroblasts to produce more collagen, which is a beautiful thing for holding up that skin envelope. I would recommend getting your retinols from a medical office, whether that's a medical spa or a dermatology office. These are going to be formulated different, a little bit more micronized, so the drug can actually penetrate into the cells. They're going to be put with other products to drive it deeper. So don't just think about over-the-counter retinoids, but go to a higher dose so that it can be more effective. I hope these tips help you to do some home care to actually feel really good and positive in your own skin.